My name is Karena Stipp, and for those of you who don't know me, I am a senior specialist realtor. And as I was setting up today, I think Susan said, "Where did that come from? What made you think you wanted to do that?" And it really was born out of helping my mother downsize and move homes. And she'd been in a home for 44 years, and she had a lot. She was on a farm. There were outbuildings. It was a lot. And, as I went through that process, I thought there has to be a better way. And there is. So that's where I started specializing as a realtor in helping seniors. And there's really a myriad number of subjects that really seniors need to learn about, and their families, right? Because it's a learning process for not only the senior who's in the shoes, but the family members are helping them through that process. And so the subject today is home health and in-home care, and there's a difference, and we're going to talk about that, right? And so we're going to get to, I always forget to put my own screen up whenever I'm talking about myself. So we're going to first introduce Andre, and I'll let you tell you a little bit about yourself. I'm kind of in a bad spot. Let me come over here.
Yeah, no, that's all right. So my name is Andre, and I grew up in Wake Forest. My dad was an old-timey general practitioner here for over 40 years back in the day. His name was Dr. George Corbin. I don't know if you've ever heard of him, but
you need to speak up. Some of us don't hear so well.
I have this. Is it not working?
Well, that's just for recording.
Oh, okay.
It doesn't broadcast. It just, yeah.
I do not have a, I'll try to be, okay. So my dad was a general practitioner here for about 40 years, and so I ended up going to NC State, got a computer science degree, and but then as my parents got older, my dad developed Alzheimer's, unfortunately, in his early 90s, and I at the time was wanting to do something to give back to the community, and so I started my in-home care agency in 2005. So I've been doing this a little over 18 years now. And I was able to help my dad and my mom as they aged in place at home. And so Comfort Care is based out of Raleigh, and I'm sure we're going to have a chance to talk a little bit about the services provided by in-home care.
Absolutely.
Yeah.
Okay, thank you. And so our second expert speaker today is Susan. Can you pronounce your last name for me?
It's Karena.
Karena.
It's Irish.
So I'm going to let
Yep.
you. Okay,
Yep.
I'm going to let you tell a little bit about yourself.
So I grew up in upstate New York and moved here with my parents and siblings in the late 70s. My father was an IBMer, so we are one of the transferred people down here. I've lived in North Carolina ever since then. Went to college I graduated from East Carolina, but met my husband, who was a NC State student. Turns out he grew up about 45 minutes away from me in New York, so it was kind of great because we had that mutual background, and when we went upstate to visit our families, we could visit both of our families. It was kind of good. Two birds with one stone. We have 3 grown children now. Our oldest daughter is special needs. I was also the oldest of 4 kids, so honestly, I feel like I have been a caregiver most of my life. I worked as a preschool teacher while my kids were little and growing up, and then when we moved to Raleigh in 2009, I just knew I wanted a different setting, truthfully a different age group, and found my way as a caregiver to Home Instead. So I've been with them since 2012. I started as an inquiry specialist, talking to people on the telephone and listening to their story and understanding from my personal background how difficult it is for people to reach out to help sometimes. You usually call when you're in desperate need and just don't know what else to do. So I did that for a little bit, and then I started working as a care coordinator, where not only do I take phone calls, but I have the opportunity of going out to meet people in their homes and helping them get set up for care, trying to keep them in their homes for as long as possible.
Thank you.
And that's me.
Thank you.
I like to sew. That's my hobby.
Okay, so today we're going to talk about one of the things that I think gets kind of confused because they get kind of lumped together is home health and in-home care. And so I'd like to, we'll start with Andre and Susan, you can chime in. You know, what is the difference between the two?
Yes. So home health is so home health care is generally medical based. So they provide nursing care, physical therapy, occupational therapy. A lot of home health agencies do accept Medicare because the care being provided is medical in nature. In-home care is non-medical home care services. So our services are not covered by general medical insurance, Medicare, or any medical insurance because we are non-medical.
Okay.
Right, and I would say too, specifically when you're talking about home health, it needs to be prescribed by a doctor.
That's true.
That way Medicare will pay for it.
Yep.
Okay.
Whereas opposed to in-home care, anyone can sign up for that.
And so the follow-up question to that is who will pay for services? So Medicare will, if a doctor has prescribed
For home health.
for home health.
Yes.
Right.
And then if it's in-home care, then you're paying out of pocket. It's private pay.
Or long-term care insurance.
Okay.
Or the VA for veterans, they have a program that will pay for some of the in-home care services as well.
Okay.
Right, and typically home health services will run for a certain length of time, and then you're done.
Yeah. Okay. So the doctor, in other words, prescribes no different really than a prescription for medicine. It would be prescribing 8 visits from a physical therapist or however many months worth from a nurse 3 times a week, whatever it is they think the need is.
Right.
Correct.
Therapy will discharge you at a certain point. You
Okay.
know, if you're not making progress, you may be discharged. Sometimes you can get an extension, so it really all depends.
Okay. And so I guess the question is, if someone has either long-term care or aid and attendance through the VA, do most home health providers and or in-home care providers accept those types of payment?
I don't know about home health.
Okay.
So for in-home care, I'd say a majority of the in-home care agencies accept long-term care insurance.
Okay.
I would think so.
The VA, you have to be a provider. You do have to be, they screen you and make
Okay.
sure that, you have to get accepted. There's a new program that is not just, there is aid and attendance, but there's a new program called Community Care. Nicole, what was it? Is it Community Care?
Yeah, Community Care Network, the CCN.
Yep. And so it's really not hard to get involved with that. You just fill out an application. You have to go to the VA to get to see a doctor so that they write that there is a need for in-home care, and they provide somewhere around 12 hours a week that they pay for.
Oh, that's good to know. So the paperwork is easier because aid and attendance can take months
It's very difficult
to
get.
apply for and get.
Yeah.
Right?
This is
Yes.
very easy.
Oh, good to know that's an option.
So just a point for that program, though, it has to be for personal
Care.
services.
Yes.
Usually, and it's only for the veteran.
It doesn't extend to the spouse like aid and attendance does.
Yeah. But
Okay.
It's still a great option if you need assistance with bathing or
Well,
medications.
and it could be a pinch hit, if, for instance, if it's a veteran and their spouse, and they really both need help, but they could do the CCN program until aid and attendance kicks in. Not for the spouse necessarily, but
Possibly.
okay. Is that
I'm not totally sure, but
Yeah.
okay?
And then they do have what's called a respite program.
Uh huh.
So there's 2 programs. They have home health services, but they also have a respite program. So if the spouse is living in the home, providing all of the care to the veteran, and they need a little bit of a break, be able to get out and go to shopping and that sort of thing, then the VA will cover the cost of that as well.
Nice.
Yep, it's
Okay.
really good. You can actually get both. I have some veterans who get a little bit of respite and a little bit of the home care.
Okay. And do they have to have served during wartime, or is
They
it
don't.
any service?
Nope.
That's another wonderful thing about
Okay.
community care.
So that's big. Because
It is big.
yeah, there's a lot of veterans out there who haven't necessarily been shot at or been during the exact years of Korea or Vietnam. Okay.
That's good.
And there is some experts in that field. That might be another opportunity for an educational session.
We had a gentleman here in October
okay.
who spoke as part of a panel.
Okay.
Yeah, and so we at least those of you who were here in October know that there are specialists out there, so you can get help answering those questions if you need them.
Yep.
So let's say that those things, there's no long-term care, there's no veteran, and it's not something that the doctor has written a prescription for, but the senior's needing help. What do the services cost out of pocket?
So, every agency has their own rates, right?
Right.
They have gone up since the pandemic. I would say probably on average you're looking between $30 and $35 an hour for services. Would that be about right? Just
About right. Yeah, there is a range, but typically most of them start at $30 per hour and go up from there.
Okay. And some agencies do have minimum
Yes.
service times. So I don't-
Most do.
Okay. Do you all have?
Yeah, industry standard is a minimum of 4 hours
Yes.
per shift. Some agencies have weekly minimums. We don't, but other agencies do. I'm not
We
sure.
do. Yes, we do. We find we can keep better caregivers longer if we have certain expectations. Plus, it gives you the opportunity of getting to know your caregiver better so that they can help, keep clients out of the hospital and just build up a relationship. And I will tell you, we have lots of people call and asks for 1 hour or 2 hours. You all probably do too. And we did try that several years ago, but with the county as big as it is, the caregivers were going all over, and it just didn't work well
Yeah.
for us. So that's hard, especially when you only need a little bit of care. It's difficult.
Now, I'm going to jump one question and just piggyback off of that, because one of the questions there on the screen is, what if a client's in a senior community? And one of the neat things about being in a senior community is you can often get much smaller increments of time if you need, because instead of driving, 15 minutes to the next door, to the next door, to the next door for the caregiver, they literally have 120 doors in one residence, right?
That's right.
And so they can charge each door or each senior that they see, sometimes in as little as 15-minute increments.
Yeah, we do that here. Yeah.
So you actually save money by being in a senior community.
Independent,
because you can get-
independent living.
Independent
Yes,
living.
yeah.
Yes. Okay.
Although, our company, I don't know about yours, but we also go into different communities, if people need longer stretches of time. So, it's not limited to your own personal home, freestanding, we do go into other places as well.
Okay. And do all agencies offer the same care and or services?
I would say probably basic, but depending on the agency and licensing, they may offer different things.
So are some agencies only caregivers who are not licensed, like nurses or therapists in some way? And are some agencies a mixture of both?
Well, so for us, like Susan just mentioned, there is different licensing that you can get as a home care agency. So we actually have our nursing services license,
Uh-huh.
which means that we could provide nursing services, but it's out of pocket because we wouldn't be able to get a certificate of need for Medicare to pay for it. Trying to think of what else. We also do like staffing, supplemental staffing for assisted livings in hospitals and that sort of thing. But I'd say for the most part, the type of services we provide in the home, bathing, dressing, meal preparation, transportation, medication reminders, light housekeeping, anything that you can think of to really help a senior be able to stay in their home. I'd say all home care agencies provide those basic services.
Really, and
Okay.
the companionship aspect of care,
Yeah.
covers all of that. And I think all of us realized when COVID hit how important the companionship and just the physical touch point is when you're, especially a senior, because sometimes it's lonely out there.
Yep.
And the isolation factor when COVID was devastating to so many people, and it didn't take family members long to realize how much the isolation affects everyone.
Yep, that is very true.
So let's take a look at some myths and truths. This myth is I can save money by hiring a caregiver outside an agency. But the truth is you need to use caution when hiring individuals to ensure they're qualified and have adequate insurance. So when you go through an agency, they've been vetted and they're under the licensure of that agency. So you have a layer of protection there. Where you can call the agency and say, look, this person's not working out for whatever reason it may be. They're going to have a conversation with that caregiver on the other end of that to see, how can they either work with that person to ensure that they're better trained or they can serve the seniors better, or perhaps it's just not a good fit.
Yep.
Exactly. Yep.
Okay.
Plus, if somebody decides not to show up on any given day, usually there's backup to fill that need.
Whereas it wouldn't be if you just had Betty down the street.
Right.
Yeah.
And what's also really important too is all of our services are overseen by an RN. So it starts with the RN who comes out and develops what's called a plan of care that the caregivers follow, and the RNs are making sure that the caregivers that are being assigned to a particular individual has the skills that they need in order to provide those services. Because some clients that we have more difficult care needs than others. So we want to make sure we're sending in the right people.
Okay. Good point. So this myth is in-home care services are only appropriate after a hospital stay. And the truth is some agencies offer even preventative services, especially following a new diagnosis or start of new medication. So do you anything you want to add to that?
Just that we would, especially in the case of a new medication, if the client or family member can say, there's side effects, this is what we need to look for, it's great to have the caregiver eyes, just watching so we can say, especially if a client can't speak for themselves.
Yeah.
Okay, good point.
So is the home care the first thing? Is that any kind of skilled nursing? What is that?
Home care is not skilled nursing.
Do you
Or
mean
is
home
it
health?
covered by, or home health?
Home health is.
Yes.
Yes,
Home
that's
health,
what I'm-
yes.
I just wanted to make sure.
Yes.
I understand that in home.
Yep.
So this myth is I can save money. Oh, I went the wrong way. I'm sorry. Let's see. Home health and personal in-home care can't be used in a retirement community setting. Well, we've already talked about that. Home health and personal home care services can be used in independent, assisted, memory care. So in some cases, their families will hire someone, even though their loved one is in a community, they still may have a caregiver who comes to help with things during the day or sits with them for companionship or just to make sure they don't wander in some cases, especially in
Exactly.
memory care. That can be an issue if they're a wanderer.
Yep.
Yeah.
For sure.
Right.
Yep.
All licensed companies do the same thing the same way. And the truth is, companies have varied specialty certifications, staffing requirements, and service delivery philosophies. So that's why you want to interview several different ones. and see who's going to work the best for you and your situation.
Absolutely.
And this myth, happens unfortunately more often than not. I can handle it myself with a little help from my kids and friends. And the truth is, extended caregiving can take a toll on family members and friends. It's okay to ask for help.
Even though it's hard, it's okay to ask for help.
Well, and it's truly, I mean, I've been in that role for a short period of time when my mother was in hospice, and she did hospice at home. And Mom had a dear friend who stayed with her the last couple of months who had worked at a home health care agency. So that was something, that for a while, all Joe did really was drive Mom to doctor's appointments and kind of make sure she got it safely in and out of the car and so forth. And then at the end, it was the two of us caring for her. And it's tiring. If any of you have done that before, it's overwhelming. And for family, there's the added emotions that go with that, seeing your loved one incapacitated in whatever way that is. And so, I can remember my brother asking me something, and I said, well, my comment to him was, well, I'm trapped. Like, in other words, I can't leave the house because Joe's gone that day, and it's just me, and I needed to be there. And so imagine that going on for weeks or months or years for family members, and maybe you've been in those shoes. So it's not always other family members who step up and recognize that, because they just either feel like they can't handle it or are too far away, or whatever the circumstances are. So even if you just have a short break from a caregiver, a few hours a day or a week might be all the difference that's needed.
Sometimes going to the grocery store by yourself is delightful.
Right?
No, I'm serious.
Yeah.
Long-term systems and support services provide for respite care. That's what I understand.
Yeah.
Long-term system supports include services such as personal care, respite care management, home-delivered meals, mental health and addiction services, assisted living, community residential services, and nursing home care.
So what is that?
Long-term systems and supports. That's what the state is providing to us, long-term system supports.
I'm not familiar with that.
And I'm not either.
Okay.
Is that a private insurance?
No, that's what the state is ensuring we have by being residents here. They want to ensure that these services are provided to us, medical or non-medical, and they can be institutional or home or community-based. In other words, in North Carolina, I don't know if any of you look at the scorecard that AARP puts out. North Carolina is ranked 41 in the nation for the services it's been providing out of 50.
I'm not either.
It's not paid services.
But they're trying to improve, because as of last Friday, probably a lot of you are aware, 600,000 people became eligible for Medicaid.
So it's
Medicare
Medicaid.
already, but Medicaid. And a lot of us are in that position where we qualify now for Medicaid. Over 300,000 people qualify automatically, and they don't even know it based on their income.
My suspicion would be that while the state may have the best of intentions in providing those things, that it would be tough to procure some of those services depending on where you live and what your needs are. It's no different than if you want to go into a specific community, sometimes they may only have one or two of those beds that are specified to be Medicaid beds, and the rest are all private pay. So then you have a waiting list in some cases, and that's just my suspicion. I'm not,
But to the point of Medicaid, though, there are home care agencies who have made it their business to become experts in providing services, home care services, using Medicaid pay. We used to, but it became so complicated and so difficult that we were no longer able to do it. But if you need names of agencies who have made it their business to become the experts in that, I can definitely provide that.
and it also might behoove you to to talk to someone like Carla Payne at Aging Care Matters, and there's other agencies out there like that.
Yeah.
Carla spoke back in
Yeah.
June when we started
Yeah.
our series, and so she's an expert in being able to help you get to the help that you need.
That's right. Yes.
So I think a consultation with someone like that, the money is well spent because they have years and years and years of expertise, and they can answer the question and say, oh, well, this is the person.
Yep.
So it
Yeah,
saves
I
you
agree.
literally months and weeks of frustration in trying to hunt down the right person if you ever get to them. Yes.
We weren't at that seminar. Could you give me that name again?
Carla Payne, Payne. She's actually going to speak next month, I believe, is our January.
Okay.
What is the subject? Living to be 100. She'll be here in January, and she's her agency is Aging Care Matters.
Okay. Thank you.
Yeah.
Mm-hmm.
She's very knowledgeable.
She also has an adult daycare here in Wake Forest. Wonderful lady. Let's see if it's going to click it. It's not.
Uh-oh.
Stuck. I think we were at the last of the myths and truths. Let me see if I'm right. Okay, well, we're gonna move along. I just did a couple of tools. So up here on the table, I ordered these myself from Medicare.gov. You can get your own copy. There's a bunch of booklets that you can choose, but it will help you answer questions about Medicaid, Medicare, and choosing the right nursing home, who pays. So these are just some of the booklets I selected. I think you can get 5 for free. So you go to Medicare.gov, and you can sign up for those. And then I have a couple of handouts that I provided. Whoops.
It's okay, I got it.
Thanks. The real truth about healthcare at home. So this one is what is healthcare? What is home healthcare? And then this handout is 16 questions to ask before hiring a caregiver. Okay, so those I would keep on hand if you're in the business or in the in looking for someone who's home health or in-home care. So because I can't get this to forward, and I think we were at the last one, let's open up for questions. I'm sure you have many.
Okay, I'm assuming that all 3 of you are from a different company.
Yes.
Do you have your information available?
Yes.
It's here.
Address, telephone number, and so forth?
Here on the
Yes.
table, right? So this is from Comfort Care, and this is from Home Instead. And then I'm the senior realtor.
Okay.
So I help, yeah. Okay, other questions?
What is it you do exactly?
So I help seniors who need to sell their home or and downsize, move into, for instance, a senior community. If you'd like, if you're thinking about going to a senior community and you want to tour one, I'd be happy to go with you and discuss the sale of your home if you're still in a home. And it may be that the home you want to move from the home you're in, which is maybe a 2-story, 4,000 square foot, everything upstairs, to something that's going to be a ranch and work better for you. So it just depends on the situation, but that's what I do, is specialize in helping seniors through that process. Yeah.
Do you have access to contractors who know how to make your home ADA compliant?
I do have some contractors I've worked with, yes. Yeah, so I could.
Yeah, there's certain things that the standards that are met that way.
That's right, yep.
Okay.
Yeah, Kara?
We have a neighbor who paid in for years into long-term health care, and her son has tried to help her get that in place, and she doesn't want him to help her. So here she's put out all this money and isn't being used. So I'm thinking if she does need the care, it sounds to me that if her doctor prescribes it, she could have somebody come in and it would be paid by Medicare.
Correct.
All right. So then the next question is, maybe if it's somebody who's not her son, and I don't want to get involved, who would we suggest to him? That
She has to okay that, because we've actually been going down this road with my mother-in-law who has long-term care, and she's in a senior housing, and she has a prosthetic leg, and just needs a little more help. And so we had to fill out a third-party authorization form, and she has to okay that. But each time we've had a phone call, it's been putting one of the kids on the phone while she's on the phone with the insurance people to give them the okay for that conversation. And finally, somebody said, "We'll send you a form, and you can fill it out." And then that gives her, any one of the kids authorization to speak to the insurance company about this. But there's a lot of hoops to jump through to be able to get to that money. She's going to have 90 days in her case with her policy, and they're all different.
Yes, they are.
Okay, she has to have 90 days of home health in a year, whether it's private pay or it can be a combination. It can be prescribed by the doctor and or private pay. And once that happens, then she can get to, it's over $500,000 she has.
Isn't that something?
Yeah. Mm-hmm.
Sitting there.
Right, yeah. And right now, some of the things she's paying for out of pocket, like a housekeeper because she can't bend over very easily with the leg and all that, those kinds of things can be covered by a
in-home care,
in-home care provider, but we have to be able to jump through all the other hoops to get to it.
Mm-hmm.
And then she can use it.
Yeah, there's specific things that long-term care looks for before they actually approve one of their clients. They're called ADLs, or adult daily livings, things that she needs to have help with, and she will need a prescription from her doctor. That's one of the things that the long-term care will send out. So if she's not comfortable with her son advocating for her, there are people that you can hire to do that, or a trusted friend, another family member. Sometimes you really need an advocate because there's a lot of questions to answer, and like you said, a lot of hoops to jump through.
So I think she might be overwhelmed looking at the paperwork, but
Yeah.
as I said,
It's overwhelming.
I'm not going to be the friend or mom.
Yeah.
There's I think they're called life management givers, caregivers.
Right.
And you can hire them for helping navigate all of this specifically. They can also take care of last wishes. So if you don't have any heirs, and you want to make sure that you're buried and your will is taken care of, then you can hire someone like that. So they are out there. They're available. Somebody had asked me that question in another event, and I had asked a friend of mine. Let me see if I can.
So
Life.
they're called life management.
Life care managers.
Life care managers. I think that's right. Life care.
And actually Carla Payne.
I was like, Carla would know something.
Yeah, I would think.
Yeah.
And I think she's the president of the Southern Association of Life Care Managers too.
So that's good that she's coming in January. So about the 90 days, so we do accept a lot of long-term care insurance. And what we've experienced is most long-term care insurance policies have what's called an elimination period. Usually it's 60 to 90 days. And what they have to do during the elimination period, the client, the policy holder has to pay out of pocket until that elimination period is met, and then the insurance company will start paying on it. And what we really recommend is that individuals go ahead and start working down the elimination period before things get so bad that all of a sudden they need 24/7 care and they've got to pay out of pocket for many hours for that 90 days. But if you can start early, where maybe you only need 4 hours a day, then it's a lot less expensive for the policyholder to work through their elimination
That's
period.
what we're doing with my mother-in-law.
Right.
Yeah.
That's exactly what we're trying to do, is head it off.
Yep.
That's
Yeah.
what you call spin down. Spin down.
That's right.
I've heard that.
Yes.
Spin down.
Yeah. And the company is Arosa. Rachel Vaughters is the lady. And their number, if you want it, is 919-261-5880. And she'll work with your any seniors who don't have heirs, or if you need someone to advocate.
Right.
Okay,
And if
she
you,
was recommended to me.
yeah, if you think about 90 days, whenever it was that you signed up for the policy, 90 days didn't seem like it was very long.
Right.
But when you need care and you're trying to work towards the end of your elimination period, 90 days can seem like a lifetime, especially if you've reached the point where you need a lot of care.
Yep.
So, yeah, to that end, yeah, that when you can sign up, go ahead and do it. So you've got that behind you.
Yeah.
Yeah. Okay. Other questions? Those are good questions.
So you know what the process is for getting qualified to be able to do that? To be eligible to get those services?
Yes, you have to meet the ADLs. Most companies look for 2 or 3 of the 6 or 7 ADLs. Yes. And so for our company, we keep logbooks in our client's home where the caregiver is responsible for every visit that they're at, noting what it is that they're helping their client do. Then we collect log notes every 2 weeks. We send them to our accountant, who sends them to the long-term care company. She's also sending the invoices as they come out, because everybody's counting down the days to see how quickly they can get to whatever it is their elimination period is. Some of our older seniors who bought their policies a long time ago have the benefit of maybe 30 days. Every once in a while, we actually still have one that has none.
I know.
It is very, very rare, but you kind of sing a hallelujah when you get
Yeah.
Yeah.
Once in a great while.
Right. So that's another thing that's important when you are looking for a company, making sure that that company supports you as you work towards this goal.
Yep. I'd say all agencies, though, do have documentation from the caregivers on what the tasks that they are providing for a client. It's a state regulation, and so it's a requirement by the state that our caregivers document what they're doing in the home, and that it can be provided to anyone, whether it's a long-term care insurance company or the client. Whoever needs it.
It's a great thing for family members to see too, especially if they're not in the home frequently. They can just go to the logbook, and just flip through, see how things are going. Yeah.
So back up a minute. I'm going to ask a question for the benefit of some people in this room, I hope. If someone has money and they're trying to spend down so that they can use benefits, there is a process to go through. Are you familiar with that with the state?
We've never had to.
You mean for to get on Medicaid?
Oh,
Yes.
that I don't know.
You're not familiar with that?
I mean,
well, that's what's going to happen when you end up at a nursing home or you're needing some of this care. You're going to have to qualify through the state. And what you have to do is go to the North Carolina Departments of Social Services, wherever you live, fill out an application, get someone to be your caseworker, and they will facilitate the benefits that you need.
This is only if you have no assets.
No. If
Medicaid?
You have assets, yes. Yes, you can have assets now. As of last Friday,
Oh, really?
the limits have gone up.
And what are the limits? Do you know?
I have not looked at those.
Okay.
I've not looked at those. But you can contact somebody with the state at the SHIP office. The Department of Insurance will walk you through anything you need to know about long-term care insurance. If you need help getting any type of help with a loved one right now, you can go to long-term care ombudsman with the state. They will help you walk through anything you're facing. I mean, if it's somebody who will not work with you on getting your loved one into a nursing home, you need to ask questions. You need to talk to an ombudsman. And they're available for free. That's what the state is providing to you.
That is true.
Because you pay their taxes, and you're entitled to this for free.
Yeah.
You said through SHIP you can get.
What is SHIP again?
SHIP is Seniors Health Information Portability Program. It's a division of the Department of Insurance with the state, and you can call them now. You were supposed to be able to call them, and you can year round, but they work very hard every year at the end of the year getting everybody qualified for their new insurance for the next year, seeing if the plans they're on are really meeting their needs. And if you're not looking at those needs right now, you need to be looking at them.
Could you repeat that name one more time?
SHIP, S-H-I-I-P.
I know how to spell SHIP.
Seniors
Stand
Health,
for.
Seniors Health Information Portability Program.
Yep.
Thank you.
I think the senior center has some coordination where you can make an appointment with a SHIP person.
Yes,
seen it
that's
as
right.
well.
That's right.
Okay, that's good to
Did you
know.
have a question?
How do you interact with hospice?
We interact with hospice all the time. They're a great support group for families. We encourage it if you need that extra layer of support to go for it, especially if one of our clients is really not physically able to get out of the house to go to the doctors. That is a conversation to have. Is it time to bring that layer of support in? So for us, doing the regular services that we provide, the personal care, the meals, the light housekeeping, hospice will provide the skilled support, the nursing who may come out once a week. They have faith leaders and social workers who come to provide emotional support. So we work with them all the time.
Yep.
And we encourage families, if they're ready for that, to do it.
So what y'all are doing is providing a service for a fee.
Right.
Okay.
We do, yes.
That's a different matter. That's a different matter. Because this can only happen if people have money and they reach a certain point and they can't pay anymore. That's what I'm here for. I want to know what is going to happen when I can't pay for those services, when I don't have the money to pay for those services. And what I hear you saying is you do this for a fee up to a certain point, and then the person has to go into a nursing home because they get qualified to be in a nursing home because of their ADLs being compromised, or they're not cognitively aware anymore. So they have to qualify for Medicaid, and they do that through the state.
Right.
You have to do that through the Department of Social Services. You have to do your spend down, and you have to get into a facility. And the state provides a listing of all the facilities in North Carolina, how they're graded.
That's true.
Everything is on the state website. DHHS, Department of Health and Human Services. Go there, look at what they've got. You will find information that you did not know existed that you're going to need later on.
Okay, Richard?
It costs money, but if you get a good elder care attorney with a revocable living trust, you can navigate all that paper, or the attorney does it for you. Navigates all the paperwork to get you qualified to get paid by
Medicaid.
We've got that subject coming up in April, navigating taxes, legal and financial matters. So we'll get to some of that then.
And of course, you're saying if somebody has money, then the best thing you can do is get a good elder care attorney.
Yes.
Right. A lot of people do. There's different groups of people, but there's a lot of people who have at least a chunk of equity in their home. But if you wait until the very last minute and it's just deeded in your name and you haven't spoken to an elder care attorney, then that's part of your spend down is what's going to happen in order for you to, at some point, then you'll eventually qualify for Medicaid.
You put everything in your trust, and that way it's...
It shelters it, essentially, for your heirs, whomever that may be.
And I don't think I sent you the contact, but it's also my understanding that someone can purchase a portion of the home, like even just a small amount, as long as you're not owning the entire home. And then it's not counted as your equity.
Oh, interesting.
Yeah,
Okay.
so it can be done. And not be in a trust.
Okay. That may be, I don't know, you'd have to talk to an attorney and see if that's the fix for that 5 year, if people have waited
That's
too
where
long.
you can talk to an ombudsman you can ask them those questions. That's the very kind of thing they're able to answer.
So that might be the first consultation, is to consult with one, because it's not going to cost you anything. And then from there, make a list of things that you want to, if you need, then you can talk to an elder care attorney.
Got a phone number for that person?
The ombudsman, do you have?
It's listed under Department of Health and Human Services on Google. If you have a computer, just Google North Carolina Ombudsman.
Department of Health and what?
Human Services.
Human Services.
Right.
And they're the ones that also provide the state regulations for our services, because our services are regulated by the state.
Yeah, and we do have to be licensed.
Yep, we have to follow rules. And it's a good thing. It's a really good thing for everyone, and for the for the people receiving services, and for us. It's there to to protect everyone. So.
Other questions?
It's complicated.
It's complicated. It is complicated. That's why the
complicated.
room's so full today, right?
Yeah.
Yeah, because you all had questions for yourselves or for other people. Yeah, for sure.
So just so you know too, if you do find yourselves needing some home help at home, it's really a simple process. It can happen very quickly. Let's say if someone falls, they end up in the hospital, and then when they get home, they're going to need a little help for a short period of time. There's no contract. We don't have a contract. We can do services for 1 day, 2 days. All we require is 24-hour notice to cancel service. And so if you need help, all that has to happen is to schedule the nurse to come out, do the assessment, and then we can have a caregiver right there. It can happen in as short a time as 24 hours. It's better if we have a little bit more time. 3 days is luxury, but it can happen really quickly. So if all of a sudden you find yourself in need, of help, don't think it's going to just take forever to get that help that you need. It can happen very quickly.
That can also go through the Department of Aging Services. They can call out someone to do an assessment. I had to call someone out. They were there in 45 minutes.
Yep, so that's good.
I assume as a healthcare provider or a service provider, that if somebody got into a situation where the funds were running out, that you would help them transition or give them resources. And I'm sure you do it all the time, because people do run out of money and then they need to go to Medicaid.
Yeah, so we love to do that, but we're not the Medicaid experts.
I know you're not, but you would say, okay, your next step is
yes, you could
go
look
talk
into
to so-and-so, go talk here. You might give them a list of where to go.
People, yeah, we do.
Yeah, and even people who call in and I talk to them, and when I share our rates with them, and they'll say, there's no way that we can afford this. So I do my very best to give them alternatives, because I don't want to just
leave them without
hope. You
hope.
don't leave them high and dry.
Right.
Yeah, it's just so sad for me. So I do try to give them alternatives.
Yep.
Okay, other questions? Y'all are quiet.
Okay.
A lot to
Sobering.
think about.
It is sobering, right? Yeah.
Can you discuss the continuing care community versus the long-term care insurance?
Well, a continuing care community, you would still need to qualify for your long-term care requirements, but you should be able to use that as your care needs progress. Is that what you're asking?
So we actually have continuing care retirement communities in May. We'll have 3 different communities that will be represented here. And so continuing care retirement communities are private pay. When you go in, you have to be independent in order to enter, and you'll have to pass both a health test or some kind of, screening from a nurse, and then also financially. Most of them here in town are at least $500,000 to $750,000 to get into, and then you pay monthly rent. When you get past the independent portion, so if you or your spouse are needing assisted memory care, skilled nursing, then if you do have long-term health care policy, then that can kick in and help pay for that. But you have to be prepared for that buy-in, and then also at a minimum you're paying probably in the range of $5,000 a month, which is all inclusive. There's food and so forth, transportation and all of that. But you have to be prepared financially in order to consider a continuing care retirement community.
You need to have purchased a long-term care insurance policy before
You don't. So you can go in totally private pay for a continuing care retirement community. You just have to have the money to do it. But if you do happen to also have a long-term care policy, they will accept that when you get to the part where you need either help, where someone could come in either from the community or from outside the community, because you can still choose, and or it will start locking in at like assisted living, skilled nursing, and so forth, whatever your policy pays for.
And as far, I don't know if you have a long-term care policy or not. Typically, most people purchase their long-term care policies when they're in their 50s or 60s. Anything probably beyond that, for most people, might be cost prohibitive.
Right. Yeah.
I bought mine back in '98 when I retired from back then. And my premiums to start out with was $800, a year. It's now over $4,000. And the last they offered me to get another maybe 125 more a day benefit, they wanted $6,000 a year. But I have the option to stay where I am, and my monthly benefit stays where it is. It's a little bit over $8,000 a month now. My benefit when I need long-term care, which is good.
It is.
So if I wanted to go to $6,000 a year premium, I'd get maybe $10,000 a month. I didn't think it was worth it, but I still have that $500,000 coverage over 5 years' time. So I'm looking at. I know the nursing homes now are over $8,000 a month. I would imagine.
Oh, more.
But at least that's what I would get. And then I'm hoping I have enough assets to make up the difference. So I'm staying with my long-term care insurance, although they will price you out. I mean, they're not even writing the policy that I have, they're not even writing that policy anymore.
Right, it's completely different because they realize people are living longer.
So it's associated.
They were going out of business.
A life insurance policy that
you can get a rider on the life insurance policy, and the rider allows you to tap into it if you need it for long-term care, or you can leave that amount to your heirs, just like a normal life insurance policy. That's right.
If you want to do it, if you can at our age, the price is.
In your 50s, the long-term care insurance, I've priced them. I tell people it's like a nice car payment. And if you're at 60 or over, you need to think closer to a house payment monthly. Yeah, that's what it's going to cost you. But as far as nursing homes, the average person in the U.S., these are the statistics, the average person will only spend 2.5 months in a nursing home at the end of their life, and that average cost is about $45,000. So most of the money is going to be spent with somewhere in between, right? That's the bulk of the money and time.
My long-term care insurance will pay for in-home care, daily care, or whatever.
It should pay to walk the dog at that price, honestly. It should pay for all of that.
It covers other things other than being in a nursing home.
Right. Yeah, yes.
I just have a few comments to add to the conversation. I'm a retired social worker, and I also work for hospice, and I also have long-term insurance. So the one comment I'd like to make is, I took my long-term policy out when I was 55. As was mentioned, when you become 60 and above, it's prohibited for most people. But if you take out a long-term policy, there's a program called the Long-Term Program with Medicaid. And what that means is, when the screen of your policy is met, you apply for Medicaid and your assets are never looked at, which is phenomenal. Wow. No, you don't have that. You have an entirely different policy. I can talk to you about that after. I mean, I'm not in business or anything, just that I'm
I don't need it yet, but
because I worked in this system.
I'll keep it going because I
Yeah, I can
think
talk to you.
it's some benefit there.
Yeah.
What is it called?
It's the long-term care with Medicaid.
With Medicaid.
With Medicaid, yeah.
Okay, Carol?
I'm sure that anybody selling these policies isn't going to disclose it. My question is, I'm curious to know, of the people who have the long-term health care, is there out there any statistics that show, like 12% use up what they put into it, or whatever, I just pulled that out of the air. I wonder if there is a percentage they can say that it has benefited, because people selling the policies certainly aren't going to publish that.
Well, it's my understanding that when they first brought these policies out, part of the reason why you've seen amendments, those of you who have them, is because then they started seeing how much they were costing the insurance companies. They were losing money. That's right. And so that's why they've become more and more expensive, and they've changed the rules. And if you still want this coverage, you have to, pay, because it's every year my mother-in-law gets, it'll up it. And she complains, and we pitch in and pay the extra is what we're doing, as the kids are, because we won't let it go. She would have let it go.
Right. And at this point, she's already put so much in.
That's right.
That's the hard usually. Okay.
Right.
The other thing you do get, these insurance companies, maybe the government made them do it, you get the benefit of whatever premiums you put in. So if you cancel your policy, and I've been paying for it for 20 years, whatever premiums I put in, even if I don't continue the policy, they'll cover that much money if I ever need it. That's it. That would be the...
I wouldn't say that would be the case for all policies. I would sure check that before you'd stop paying.
right, exactly.
Well, that's Okay, other questions? Yes.
Well, just to point out, I work with a whole bunch of really smart people. And in our 40s, many of us got together and discussed this topic of long-term care insurance, and we all came to the same conclusion. It just wasn't worth it.
Okay.
Too many ifs and buts and qualifications, and once you quit, you lose all of your money. Once you stop paying, you lose everything.
So you don't want those because you don't have it to feel bad.
Pardon me?
You don't want those unless you do not have it to feel bad.
That's why we're here today.
There's a lot of people pay for a lifetime and then never use it too. They die.
That's right.
That's exactly right.
Which is why the life insurance policy with the rider has become so popular, because at least someone gets something. That's what's so nice about that.
I just want to say, long-term insurance is like any other insurance, like homeowner insurance, like car insurance. It's there if you need it. If you're going to be over 70, forget it. Don't even consider long-term insurance. You'll never be able to cover the cost.
Right.
Never.
Yeah.
You missed it. Yeah. You can do it in your 50s.
And if you can cover it, then you can probably do without it anyway. That's the truth.
That's true. You last in a nursing home, 3 years is the max. That's it.
Yeah. Most people spend it in assisted living, which is why you're seeing so many independent living communities that are leaning into that space and bringing either they have providers that come in or are in-house. So, some have menus that they provide where you can add on.
A la carte.
Yep, that's right. And so you're seeing more and more of that, and that has to do with the fact that they have to be licensed if they're truly in assisted living or above. And so by bringing in those services, they're able to bridge that gap, keep you longer. It actually saves you money.
Yep.
So in that case, if you're the senior that's living there, it's a win-win for you.
I just have another comment about continuing care environments. It's not the best. The reason is they might have 500 people that live there. more or less, people don't go in when they're in their 50s. They go in, a lot of them, late 70s, 80s. So a high percent of those people are going to need nursing home care. You know how many beds they have?
Right, exactly.
Maybe 50.
Exactly.
One of the most expensive places here, I posed that question to them, and they said, well, if there's no bed, then we'll place them elsewhere, and when a bed opens, they can come here. So if you're married, you'll be taking a car, the nursing home where your husband is. So, I mean, it's not a panacea. A lot of people say, well, I have no children, no one's going to take care of me. That's a myth anyway. My daughters wouldn't take care of me. I mean, it's just not, it's not like that anymore. It's not like it was 20 years ago. You basically have to look out for yourself.
You're not going to have the beds available.
You're not, you know, you basically have to do it. If you have the house, then you better be putting that somewhere, or that's going to be part of the look-back period. They're going to be taking it and accepted. That's how you're going to be paying for your care, unless you put it somewhere. Hide it is the expression. Well, I mean, you haven't put your house in someone else's name, and it's not there for 5 years. It's going to be considered your asset, and it will be used for the nursing home. That's the fact. There's nothing you could do about it.
Well, then your daughters don't get it.
Plan, you can plan.
You need to plan, but when you're 70 years old, 75,
Your house is to take care of you.
you gotta be doing it today, not tomorrow.
Okay, last thoughts, any other questions?
Yeah.
So I didn't have the postcards print, they are at the printer. So these are next year's subjects and dates through July. So hope to see you back in January for Living to Be 100. And note that we are at a different time and day. So we are moving to Tuesdays, and we'll start at 10 o'clock. And that's so that we can get a bigger room, which is going to be much needed. Right? That's y'all. If you build it, they will come. Has been my perspective, and it certainly has worked because y'all are filling the rooms, and I thank you for that.
I'm really surprised it didn't that it capped off at 6, because when you start with these chairs, I'm like, whoa.
Right.
But I'm
Right.
glad it did, and obviously there's a lot of
Right.
other questions that we had, so I thank you all.
So let's give our panelists a hand. Thank you so much, ladies, for coming and sharing. Thank you all for coming today, and I look forward to seeing you next year. If you would, please fill out your survey that's on your seat and hand that in as you walk out. And I hope you all have happy holidays, whatever those are you celebrate.
Yep, and
Yes.
we both have information up here if you want to take some with you just to take a look at it. And I'm always open for questions, so you're more than welcome to reach out.
Thank
Of course,
you.
you're welcome. Thank you.